Hello class, Nursing 265. This is Frances Carvalho, your instructor. I'm going to do a series of short videos so that we can finish up the Neuro Part 2 that we were unable to do last week. My producer, cameraman, and director is my daughter, and she... Turn it around so you can so they can see you.
Is this good?
Yes.
Hi.
So she's going to be filming us, and then we'll be uploading short segments of this PowerPoint so that you can review it at your convenience. This PowerPoint is on encephalitis. It covers slides, or this video recording is on encephalitis, and it covers slides 18 through 22 on your PowerPoint. And we'll get started. You'll probably see me looking at my PowerPoint here, and that's to make sure that I stay on track. So on slide 18, it talks about the clinical manifestations of the encephalitis. And the first thing that you'll probably see is that the patient has cold sores, and that's your HSV virus. The other thing that they may have is a history of insect bites, and that would be your either Zika or West Nile from mosquito bites. The other thing that they may have in their history is swimming in fresh water. As we know, those are cesspools. Exposure to infectious diseases, just like I mentioned with the HSV, that is something that happens with droplet in contact with infected people. I've even heard of babies getting infected and having HSV encephalitis from some random person kissing them at church. So be careful with who you let kiss you. Travel to disease prevalent areas as well as part of your history assessment. So you want to make sure that they haven't been to like Miami or Rio, where they may have been exposed to Zika, or here in South Texas, West Nile. Okay. The clinical manifestations, how this patient is going to present, is very grave. They're going to have high fever, and they're going to have signs and symptoms of neurological deficits. They may be confused. They may not be able to walk. Certainly they may have nausea and vomiting as well. They may even have seizures. Some of the problems with these manifestations is that it looks a lot like meningitis. And so we're going to first initially treat them and isolate them like a bacterial meningitis, give them their antibiotics, send them off to lumbar puncture, and then that's where they'll determine that it is viral in nature. Okay. So the diagnostic imaging does include a lumbar puncture, also may include a CT scan of their brain, EEG monitoring for brain waves, and happily now there are blood tests for both HSV as well as West Nile to determine what the source of the problem was. While there are no specific antiviral drugs, we can give them a general antiviral drug such as acyclovir. We'll also give them anti-seizure medicines to prevent seizures, steroids to reduce the swelling in their brains, as well as sedatives, and of course acetaminophen for fever and headaches. That, as you know, can be given rectally in case they're nausea or having vomiting. Your nursing implications, once again, we're going to treat this like meningitis until we know otherwise. But the treatment also is similar to meningitis in that they will need a quiet, dark room. They will need to be flat on their back, especially after their lumbar puncture. And then once they're not having symptoms of their lumbar puncture, they can be up about 15 degrees with their head of the bed. Vital signs per routine, so you're going to be in the ICU. That's every 15 minutes. Neuro checks a minimum of Q2 hours. But if they're still actively declining in their neurological function, then it's going to be more frequently than that. Bed in the low position, of course, in case they try to get up out of bed. They are a fall risk, seizure precautions, and of course, if they have any compromise in their airway and breathing, they will be managed with a ventilator. Okay. The teaching involved on this is to really make sure that they understand about the precautions needed for herpes simplex virus, as well as mosquito control. As we know, one of the major vectors are mosquitoes, and so we want to make sure that they wear long sleeves, don't go out at dawn and dusk, spray themselves with DEET, as well as ensuring that there's no standing water around their premises. That concludes encephalitis. I'll be uploading this shortly, and then watch for the next video, which will be over brain abscess. Thank you.
Bye.